Tim Bennett here from the Cortland Voice, and I'm here with Hannah Potts from Cayuga Health. Hannah, how are you today?
I'm great. How are you, Tim?
Good. So today we're going to speak with the Cortland community about surviving cancer diagnosis. Hannah, but before we get to that, we want to hear about you. Tell us about Hannah Potts.
Well, thank you for having me back. I'm Hannah Potts. I'm a nurse practitioner here at the Cayuga Cancer Center.
Mhm.
I work collaboratively with the doctors and nurses, seeing and treating patients with cancer diagnoses, as well as benign hematologic disorders, which, like anemia, sometimes we work up. But I'm also the coordinator of our cancer survivorship program.
So you use the key word survivorship. What is survivorship?
Well, it's more than surviving, right? So we want you to thrive. The cancer patient is considered a survivor at the time of their initial diagnosis. So immediately we're starting to think of how can we help you as a cancer patient thrive within this diagnosis through your treatments and after.
Gotcha. So basically, survivorship is helping someone, as the song says, live their best life, moving on as you progress after, once the diagnosis happens. Basically, is that what you're saying?
Yeah, so in the US, there's 20 million people living with cancer diagnoses, and we want all of those people to be living their best lives. We want to think of this as not just a moment in time, but also an opportunity for us to help you live a healthier life, to support your physical health, to support your emotional health. And we're engaged in that during treatment. And classically after treatment, we're really starting to think about how can we get patients back to their day-to-day lives and their before treatment lifestyles.
So why is it important to understand like the spectrum of a diagnosis?
Well, survivorship in and of itself encompasses all aspects of a patient's diagnosis, and it focuses on maintaining that healthy lifestyle, encouraging wellness, and supporting individuals as they navigate their diagnosis and their life experiences. And cancer does come in sort of different forms, right? We have different types of cancers, and those act differently. And we have different stages of diagnoses in terms of early stage or late stage, and how we treat those and how we can support those individuals through those different diagnoses and stages is really important.
I see. Well, let me ask you this. Can you educate us on maybe like what type of programs that you have available for patients?
Yeah, I'm excited to talk about that because we have a lot of services in
Okay.
our community and the surrounding area. So at the Cayuga Cancer Center, we have opportunities within our clinic in terms of offering support for nutritional services. And we have other services that we can offer by referral. So physical therapy, occupational therapy, how do we use our hands to manipulate things when we have changes in our functionality? We have speech therapy. We also have integrative services like aromatherapy. So things that you might not think of as the classic Western medicine. We encourage massage, and we talk to patients about different collaborative relationships with their other providers. We also work really closely with the Cancer Resource Center of the Finger Lakes. They're based out of downtown Ithaca, but they service the entire Finger Lakes and offer support groups, education, and we have a great working relationship with them.
I see. Because it's funny that you said support, because that was going to be part of my next question. What kind of support is available for someone whose cancer might be, let's say, in remission or
Right.
maintenance?
Yeah. So all of the resources that we have are available to any patient receiving active therapy and after therapy. We can use all of those resources to help you live your best life, no matter where you are in that disease spectrum. We also offer patients after their treatment survivorship summaries, which review what their cancer diagnosis was, what treatment they got, how we're going to monitor them, and also what can we do to help them grow that best life in terms of additional resources.
So tell me this, Hannah, where can someone find additional info if they want to, you know, if they want to be checked out for, cancer and, or for a loved one, maybe that's recently received a diagnosis, where can they receive more information? Like how can they come see you?
Well, one of the first places that you can always look is the Cayuga Health System's website has a lot of resources for you. The Cayuga Cancer Center website has a lot of resources in terms of accessing and collaborating. It's
Mhm.
always important to talk to your primary care doctor if you have concerns, and they can refer you. If you're concerned for a loved one, we always take referrals as well. But when we're talking about referrals for more support and how can I find more support when I'm dealing with a cancer diagnosis,
Okay.
that is available both on our webpage, but also through other resources. I mentioned the Cancer Resource Center of the Finger Lakes. They have a webpage. They have online support groups and can be present for patients in all different locations,
Mhm.
as well as family members and friends. Then we also collaborate with the American Cancer Society, and they have a wealth of information for people dealing with cancer, whether it's their family or themselves. There's also the National Coalition for Cancer Survivorship.
Mhm.
That's canceradvocacy.org. They have a lot of information about what that means to be a survivor and living your best life.
Okay, well, Hannah, thank you again for meeting with us today and educating everyone on survivorship. And to everyone watching, thank you for choosing the Cortland Voice. Have a good day.
Thank you, Tim.